I'm sweaty, cool, and clammy. Please give me some candy. You have to drink alcohol for an exercising person. I'm tired today, just need a nap. Hi guys, what's up? Welcome back to my YouTube channel. For this one new, my name is Anne, and in today's video I'll be talking more about diabetes. Actually, it's a continuation from my last video. In my last video, I got to explain what's diabetes, the types of diabetes, and the risk factors. So today's video, I'll be talking about the signs and symptoms, your diet, how you can modify your diet, and hyperglycemia and hypoglycemia. So if you're interested in hearing this, please stick around. An overview on what I said last time is diabetes is a disease characterized by abnormal insulin production and utilization, or both of them. There are different types of diabetes. We have type 1, type 2, and gestation diabetes. So for today's video, you need to know why diabetes is bad, why it's a killer disease, and why we need to adjust our lifestyle so that we can fight this disease, right? Okay, also guys, I have my iPad and I'll be referring to some points. So guys, diabetes, especially the uncontrolled diabetes, results to a very high blood sugar, which is hyperglycemia. And hyperglycemia is when your blood sugars are way too high and you can't control it, and you end up either getting some insulin or getting on tablets so that they can help control that. As we know, diabetes, if you don't know, diabetes can cause blindness, kidney failure, bunch of heart diseases, strokes, and if it's a very bad diabetes, you're gonna have your limbs amputated, right? Diabetes is a killer disease. I can say it again. It's a killer disease. So we just have to learn how we can control diabetes. For those who have been diagnosed with diabetes, you can reverse it. It is reversible, guys. It is. You can work on your diet. You can be physical. You can decide to take medication. Make sure you maintain your body weight, right? The signs and symptoms of one having diabetes include, but not limited to, excess thirst. Remember, the sugars they're too high, and it's like when let me use an example of salt. Like when you eat food that is too salty, you want to drink lots of water, right? It's the same way as diabetic. You'll be so thirsty. Another thing is frequent urination. A good example is, let's say for a child might have stopped urinating, then all of a sudden he starts urinating. Like, when you are babies, you used to urinate on your bed and blah blah blah, then you stop, then all of a sudden they start urinating. That's a red flag. Okay. You can get weight loss, unexpected weight loss. This happens especially in type 1 diabetes, when the insulin is not there and the food you eat is not being converted into energy. And so what the body does, it takes all the fat stored, Like, remember I told you ATP can be stored in the fats, right? So it takes all the fats and start breaking the fat down so that you can get your energy, right? Okay, another thing is you'll be feeling very tired. Guys, Mr. ATP is our energy, and if there's no energy, yeah, I'll be tired. What's gonna drive me? Yeah, guys, you'll be very tired. And over time, when the diabetes is uncontrolled, you're gonna lose your vision. Guys, you don't want to get to that point. So if you're diabetic, please, you can control and manage this disease. Diabetes damages nerves, especially the nerves on your feet, and this is when you can find a person with wounds on their feet, but they don't know that they have the wounds. Reason why? The nerves have been damaged. Okay, and so it's very important for you to check your loved ones' leg, assess them for any type of wounds, and take the required precaution before the wound progress. Because remember, if the wound is not recognized soon, it's gonna be a big wound and uncontrollable, and you'll end up getting your legs amputated. The symptoms may take several years to be recognized, and it's your responsibility to make sure that you're going to the doctor to check your blood, to do a blood test, so that the doctor can advise you if you're diabetic, or you can know how to manage your lifestyle. Before I even continue to any other thing, let me talk about pre-diabetic. For those who do the blood work, the doctor might have told them, you're pre-diabetic, and now you need to control your diet, you need to exercise, you need to blah, blah, blah. Yeah, all those good stuff. So what's pre-diabetic? You might be wondering what that is. So this is a borderline diabetic. Pre-diabetic is when the sugars are high, but they are not too high to be diagnosed as diabetic. Like borderline, it's in the middle. Okay, how can you know if you're pre-diabetic? Yeah, so as I said, make it a routine to go see your doctor, and the doctor is gonna do some blood work and some screening so that you can avoid the diabetic complication. And during that blood screening, that's when the doctor is gonna catch that. A screening that the doctors perform is diabetic A1C. For diabetes A1C screening, this is whereby the doctor is gonna check your blood in the past 3 months. Let me give you a brief history. Sugars like following red blood cells, and if you did biology, you might remember that red blood cells have 120 days in your bloodstreams before other new sets of blood cells are made. Like the lifespan of a red blood cell is 120 days. That's basically 3 months. See, the doctor is gonna see all the sugars that were following the red blood cells in the past 3 months. And if your A1C is high for some couple blood work, the doctor is gonna tell you you're pre-diabetic, and please watch out because you might end up being diabetic. Okay, the signs and symptoms of pre-diabetic are basically the same as a diabetic person, and it might be hard if you're not screening to know if you are pre-diabetic or diabetic. Okay, so once the doctor has confirmed that your A1C plus other tests, like they can do a random sugar test, they can check your fasting sugars, yeah, and other tests. Once they are confirming that you are diabetic, the doctor may refer you to a nutritionist. We all know what a nutritionist does. The nutritionist is gonna help you in your diet planning and blah blah blah. I'm gonna talk about that in my next video. So let me go straight to how can we manage diabetes. We can manage diabetes by eating a low-fat dairy, high-fiber food, avoiding sugary things, and for alcohol, I don't know if I mentioned it, but alcohol contributes way too much to your sugar levels. Yeah, so alcohol, it is recommended for you to take only 2 drinks per week if you have to drink alcohol, for both men and women. Yeah, before it used to be, oh, men can take 2 and women can take 1, but right now, yeah, we can all take 2 drinks only per week, guys. Okay, another way you can manage your diabetes is by exercising. For those who are like, oh God, I'm not an exercising person, I'm tired today, I just need a nap. You know what? Do yourself a favor. You can at least exercise for 30 minutes in a day, and you can do that for 5 days in a week, okay? This is gonna save you a lot, guys. And for the type of exercise that you should be doing, like you can bike. If you're not good at biking, go for swimming, do some aerobic exercise, and walking. Like do the vigorous walking, like you know how you walk and you are sweating. Yeah, that's a good one. Don't be sisi waswahili tunazoea kutembea pole pole. No, I'm not referring to that walking. Like, I mean, walk. Yeah, and there's a lot of YouTube videos that can help you in walking exercise. So guys, I told you hyperglycemia is when your sugars are so high. Let's now talk about hypoglycemia. Hypoglycemia, it's the opposite of hyperglycemia. And hyper, yeah, I'm hyper. Yeah, hyper means high. Hypo means low. So this is when hypoglycemia is when your blood sugars are low. Yeah, so do you know why your sugars can be low? Either you're not eating or you're taking insulin and not eating, guys. That's dangerous. And there are a couple things that can cause hypoglycemia, and here are the signs that you might be in a hyperglycemia state. Remember this, I used this in my nursing school, and it was so helpful. And you can say, I'm sweaty, cool, and clammy. Please give me some candy. Yeah, so guys, you'll find individuals with a diabetes and their blood sugars are low. They'll be sweating like from nowhere. They're sweating, and they'll be clammy. They're cool when you touch their skin. So if this is your loved one, please give them some simple sugars. You can give them some simple sugar like orange juice, which is a good one. You can, if you don't have orange juice, make some mix some water with sugar and let them drink. And that's not the final thing that you're supposed to do. Once they've taken the simple sugar, take their blood sugar after 15 minutes. The simple carbs or the simple sugars goes in your bloodstream at least after 15 minutes. There should be some changes. When there's no changes, please repeat. Like after checking their blood sugar, their sugars are so low, please repeat. Give them another simple carbs. If they will be eating like in a 4-hour time after an episode of hypoglycaemia, please give them a snack in between 1 hour so that they don't bottom down again, right? Yeah, so guys, that was it for today, and I'm gonna be making another video to continue on diabetes. And if you find this interesting and you want to educate yourself, and either you want to take care of your loved one in a better way, please don't forget to catch me up on my next video, okay? And guys, once again, I'm gonna repeat this video is just for educational purpose and should not be used in diagnosing anybody, okay? If you feel like you're sick, please go see your doctor, okay? Yeah, so a summary of what I said. Diabetes is a killer disease when not well managed. It can destroy your kidneys, it can cause blindness, it can lead to strokes, lots of heart diseases, and also you might end up getting an amputated limb, like your legs. It is your responsibility to maintain a normal body weight, be physically active, and have a healthy diet. Also, if you're diabetic, please don't be hard on yourself. Medication, screening, and other treatment can help you cope up with diabetic, and you can fight this disease. Yeah, also, if you want to forget everything else, please remember the signs of hypoglycemia. I'm sweaty, cool, and clammy. Please give me some candy. Yeah, okay guys, I'm gonna see you later in my next video. Please don't forget to subscribe, don't forget to share this video, and leave any question down on the comment section and I'm gonna answer them, okay? Oh guys, did you check my outfit? Yeah, this is a nice, before I forget, this is a nice outfit all the way from Kenya. It's a gift, and yeah, I think, yeah, it's a kitenge, or yeah, it's a kitenge. It's a traditional wear and it's so nice. If you think it's cute on me, please comment down below. Also guys, if you feel low, I'm gonna leave you with a quote. I have this water bottle and I have filled them with some quotes that I read every day, and one of it is, of course, you are not a character. Drink water. Drink water. Yeah, and another note for yourself, you are doing the best you can. Please don't be hard on yourself. One last thing, you are amazing. Oh my guys.